So when the Supreme Court found the Affordable Care Act to be constitutional, it really enabled a lot of important initiatives nationally, at the state level, and locally to continue. One of the most important aspects of the Affordable Care Act is bringing more people into coverage. And there's really two primary mechanisms that the Affordable Care Act uses to make that happen. The first is an expansion of private insurance where individuals enter into a health plan. And the way the Affordable Care Act does that is it recognizes that a lot of us cannot afford a traditional insurance product without some assistance. And so there's a sliding scale that will happen, and depending on income and assets, people will have support to buy a traditional commercial insurance program from Cigna or Anthem or San Luis Valley HMO or Rocky Mountain HMO. And the way that will work is that each state will set up what's called an exchange. And the exchange is really no more than an electronic marketplace, a web-based service that creates rules and guidelines for all these different kinds of insurances that will be offered to people across the state. There's a lot of misinformation that this aspect of the Affordable Care Act, or the Affordable Care Act in general, is government medicine. And in many ways, the exchange is actually the opposite. The exchange is going to create a much broader marketplace where individuals can buy health insurance. And who this is primarily targeted to is small employers, people who work for themselves, people who may have their own business. Large employers typically are self-insured, or they buy insurance because they have a great big population of people and they can negotiate well with the major carriers. It's the small employers and small businesses that really have very little negotiating room with a carrier, and whose premiums can be more expensive. And often their decision is to go without insurance at all.